Look at a modern anatomical chart of the male pelvis. The prostate is front and center. It is heavily monitored, frequently biopsied, and routinely treated. Yet, if you search the classical texts of traditional Chinese medicine, you will not find a single organ matching its description. Classical Chinese physicians did not isolate the prostate. Instead, they recognized its functions as an emergent property of the lower jiao, the lower burner. In clinical practice, if you want to understand what is happening to a patient's prostate, you have to stop looking for a discrete structure. You must learn to think in terms of fluid transformation and the flow of qi. Look at the intersecting meridian lines on this classical diagram. The physical territory of the prostate sits exactly at the crossroads of the kidney-bladder axis, the liver channels, and the spleen networks. When treating prostate pathologies, TCM focuses entirely on the mechanics of this pelvic basin. Fix the functional origin, the flow and temperature of the region, and the structural symptoms resolve. The true condition of the prostate is revealed by observing the movement of essence, fire, and fluid. We can visualize this healthy lower jiao as a schematic blueprint, a dynamic engine designed specifically for processing the body's fluids. It relies on 4 primary nodes. The kidney node acts as the system's power source. It generates what classical texts call transformative fire, or kidney yang, radiating warmth upward into the entire urinary system. Directly above it, the bladder node catches that heat. The thermal energy allows the bladder to actively process, store, and excrete incoming fluids. Meanwhile, the spleen filters inputs to prevent the buildup of heavy, sludgy fluids, what TCM calls dampness. And the liver regulates the pressure, ensuring a smooth, unobstructed flow of qi through the pelvic pathways. When this engine runs at the correct temperature and internal pressure, the tissues in the pelvic basin remain healthy. Therefore, any prostate disorder, whether it's structural enlargement or localized inflammation, indicates a mechanical failure in one or more parts of this 4-node system. Classical theory states aging is defined by the natural depletion of kidney essence, or Jing. This is a gradual cooling of the body's deepest reserves. Back on our blueprint, you can see what happens when the kidney node loses its transformational fire. The engine cools down, and the fluid in the bladder node loses its momentum. It pools and stagnates. Without that driving heat, untransformed fluids accumulate in the lower basin. This sluggishness causes frequent night urination, a weak stream, and persistent dribbling. In modern biomedical terms, we recognize this exact symptom cluster as benign prostatic hyperplasia, or BPH. A practitioner identifies this yang deficiency through physical markers. The patient presents with a pale, swollen tongue and a pulse that feels remarkably deep and weak. This presentation differs sharply from kidney yin deficiency. In a yin-deficient system, the engine isn't lacking heat, it is lacking the cooling fluids necessary to regulate temperature, creating a state of internal empty heat. That lack of internal coolant produces distinct diagnostic signs: severe night sweats, a constantly dry mouth, and a red tongue with almost no coating at all. In either case, the age-related enlargement of the prostate is primarily a state of depletion and cold stagnation, settling into the lower jiao. Not all prostate pathologies stem from depletion. External lifestyle factors can induce a state of excess, creating active blockages within the system. On the schematic, this manifests as damp heat. A thick, viscous sludge clogs the pathways, severely restricting the movement between the liver and bladder nodes. This specific obstruction is typically driven by diet and environment, excessive consumption of spicy food and alcohol, or the lingering effects of a chronic infection. The resulting inflammation translates to intense urgency, a burning sensation during urination, and a tongue showing a thick, greasy yellow coating. If that obstruction is left untreated, it hardens into qi stagnation and blood stasis. This is the root cause of chronic, fixed pelvic pain, marked clinically by a dark, purple-toned tongue. Long-term blockage prevents fresh blood from irrigating the pelvic basin. Deprived of circulation, the local tissues become dense and unyielding. While BPH operates like an engine slowly losing its power, inflammatory prostatitis and chronic pelvic pain are the direct results of the system's plumbing being packed with heat and debris. To correct these failures, the clinical objective is clear: use external modalities to force dynamic movement of qi, fluids, and warmth into the pelvic basin. Needles placed precisely along the lower back at points like BL23 stimulate the dormant kidney node, tonifying its yang energy and kick-starting the transformative fire. For inflammatory conditions, the strategy completely flips. Practitioners select specific points along the abdomen and legs, such as REN3 and SP9, to actively drain the system of toxic damp heat. When treating a patient with cold-type urinary weakness, burning moxa is held directly over the needles. This transfers intense thermal energy deep into the lower back to manually reheat the system. However, applying Moxibustion to a patient suffering from a damp heat obstruction is strictly prohibited. It would literally add fire to an already burning system. Outside the clinic, practitioners prescribe movement therapies like Qi Gong. The continuous, sweeping motions of the lower body act as a mechanical pump, breaking up the stagnation caused by modern, sedentary habits. Every needle, herb, and movement is chosen to execute a precise mechanical recalibration of the lower jiao, matched exactly to the engine's specific mode of failure. Traditional Chinese medicine provides a highly detailed map of energetic and functional pathology, but it is not a substitute for modern structural screening. This split screen represents the reality of safe treatment. Certain red flag symptoms, such as visible blood in the urine or sudden unexplained weight loss, demand immediate biomedical evaluation, regardless of the pulse diagnosis. Severe urinary obstruction or deep bone pain must be urgently screened to rule out oncological emergencies like aggressive prostate cancer. The modern gold standard is integrated care. We utilize advanced medical diagnostics to clear acute structural dangers and apply TCM therapies and lifestyle adjustments to repair the constitutional foundation. By addressing the entire fluid processing system of the lower jiao, rather than fixating on a single isolated gland,